Hello, as promised, the Captain's Log, 12:45. I have a whole posse of people in here, Dr. Dollar and Kelsey, and we're going to talk men's health today. They're going to talk to me about my sex life. Maybe, I don't know, but we're going to have fun. Listen,
for sure.
Dr. Dollar just took me on an amazing tour of his state-of-the-art facility in Fort Myers. And he is a leader in urology and basically writing the book on men's sexual health and female sexual health, huh?
Yeah. Brian, first of all, thank you very much for the courage to talk about erectile dysfunction, sex, men's health, women's health. Very, very important. A lot of the topics are taboos that we have to break because sex is health and it's healthy to have sex. And we're going to talk about all these.
So your office is basically like a resort. I mean, it's amazing. When you get there, everything is so luxurious and pretty, and we only travel with amazing looking women and that help us, which is so intimidating.
For sure.
Oh my God. Kelsey,
Plug my ears.
Kelsey works and she's your assistant?
Kelsey is a physician assistant. Kelsey was my student before she was a physician, board certified physician assistant. She's amazing. She has a special interest in sexual health and well-being. We preach what we practice what we preach. This is not the practice that you're going to have fat people and we are going to recommend that you're going to lose weight. If we tell you to lose weight, we should be skinny. If we tell you to exercise, we should exercise. If we tell you to eat healthy, we are going to eat healthy. And we talk about all this stuff. We had changed about 4 or 5 years ago to talk more about wellness and prevention of diseases than actually dealing with just diseases.
That's so true. I've been to doctors in the past and they're like, oh, you should watch your cholesterol, you should watch your weight, you should go to the gym. I'm thinking, Doc, have you actually done any of this?
Right.
But you live it. I can tell. I mean, you're so fit, you're looking sexy, and everybody in the office looks like they're enjoying themselves and having a good time.
Absolutely. And again, we'll talk today about sex, but what does it mean to be sexy? When you look in the mirror, you wake up in the morning in the mirror, you look in the mirror, you say, wow, I look good. Waking up with morning wood is a good feeling. It's a good feeling to wake up with an erection.
This is true.
Absolutely. So, and it's a self-fulfilling prophecy. When you have problem with erection, it feeds itself. All of a sudden, you have more problem with erection. When we fix you up and you feel like a man again, things are better.
Kelsey, do you wake up with an erection?
I don't.
No, not for Kelsey. This is for the guys. We're going to get to the ladies later.
Everybody's got to wake up, look in the mirror, and be like, yeah, people should want to have sex with me.
That's
how you
true.
Have that attitude.
That is true. And, sex is a few different things when I think about that. I've seen people who, on the outside, may not be the world's most sexiest people. But then, somehow, some way, they're very sexual people. Yes. And so you're helping everybody.
Absolutely.
It doesn't matter if they're a goddess. They're still they want to make love and have sex and have a good time.
Absolutely. Again, sex is important. Sex is healthy. Sex is good for your health. And we want to promote that. We want to promote this healthy behavior. The healthy behavior involves also eating healthy. The healthy behavior involves exercising. The healthy behavior is meaning being around positive people, meditation, all of the above. And Brian, I can talk to you about that for hours and hours and hours. And I know that you practice also what you preach because you're a healthy guy. You're a good-looking guy.
Thank you, sir. We're like a tag team now. I'm gonna stick with the doctor. I'm sticking with the doc. This guy's just giving me compliments one after another. Meanwhile, he's driving a Porsche. He's got this multi-million-dollar facility. He's got beautiful people all around him, and he's telling me I'm doing all right.
We are blessed. Again, I used to get laid when I used to ride the bicycle. So the Porsche, I don't think the Porsche is the key here. The Porsche doesn't hurt, but the bicycle worked very well for me for many years.
So the reason why we first started talking, obviously we're on the Man Panel together. We do the show with Big Mom and the Wild Bunch on 103.9 on Thursdays.
Right.
And they started talking about this new revolution called the P shot, right?
Yeah.
And you are like the leader in the industry, in the area for sure. And I was intrigued, found it interesting. You basically said we need to discuss and tell everybody how this works and what it is. And I don't know what it is.
Sure.
All as I know, okay, this is what I know. I tried Googling it. I found very little. Some lady wrote an article. The article was like 20 pages of basically nothing. And then somehow she tried to wrap up the fact that she was going to try the P shot. And I said, well, she didn't even tell us what it was or what it did. She was getting the O shot, right? Which is for the females. Explain to me the difference, because I don't know anything.
Let's talk about the P shot and the O shot and PRP, platelet-rich plasma. So let's talk about first what's available for men in the market. So, 20, 30 years ago, when you went to the doctor and you said you have a erectile problem, the doctor sent you to a psychiatrist because we thought it's all psychogenic. So you need to see a psychiatrist. He's going to help you out with medication because it's something in your head. After that, we figure out that majority of erectile dysfunction is organic. It's not psychogenic. As a matter of fact, 85% of erectile dysfunction is for organic causes. Minority of the erectile dysfunction is psychogenic. So later on, about 16 years ago, we came up with medications for erectile dysfunction. Viagra, it was the first one. Then Cialis, Levitra, Stendra. These are PDE5 inhibitors. They increase blood flow. But again, they don't fix the problem, the root cause of the problem. It's like a Band-Aid. You have a headache, you take Tylenol. We don't fix why do you have the headache. So before that, we also had some injection. It's called Trimix. Every time you want to have an erection, you inject your penis with a medication. This had been in the market.
That sounds like a lot of work.
It is a lot of work. It's a little cumbersome, but it works. I have 5,000 patients that use Trimix, and it works. It definitely works, but again, it's not fun to put a needle in your penis every time you want to have an erection. Several years ago, I was introduced to the guy that invented the P-shot. His name is Dr. Charles Reynolds. The guy is amazing. He's truly an innovator. And he came up with the idea that we are going to use PRP. What is PRP? Platelets-rich plasma. So 15 years ago, athletes, movie stars, professional athletes used to inject themselves with PRP.
Is that the blood doping thing?
That's the blood doping things that the Olympics committee had something against. So let's talk about what is PRP. You remember, Brian, when you were a kid, you were riding your bike, you fell off the bike, you scraped your knee, and all of a sudden, after that, you looked at the wound and you saw that yellow gooey stuff that comes to the wound to heal up and fix the wound.
Yes, it looks like it's like almost like a clear.
That's correct. Clear yellow stuff that comes to the wound. That's the PRP. That PRP has all the healing property to fix things up. So orthopedic surgeon used to inject.
Wait, how do you get the PRP?
Okay, very well. So we are going to draw your blood. We are going to use a special needle.
Draw my blood?
We are going to draw your blood. There's no pain involved. So the whole
Wait, I'm not doing this.
Brian, by the end of these 10 minutes of conversation, you are going to say, "Sign me up, though." Sign me up.
But right now it's working properly. I'm scared.
Working.
I'm scared.
So let's talk about that. I saw on Facebook, we are Facebook friends, and I see you ride your bike almost every day. Is that right?
Yes, I do.
You ride your bike. You sit on that seat, right?
Yes.
How long? You ride for how many miles?
6 to 12 a day.
6 to 12 miles. So when you ride your bike and you sit on that bike, there's pressure on those nerves and arteries that feed to the penis.
Okay.
Bike riders, they are notorious for having numbness in their penis.
Really?
Yes.
I'm going to stop riding bikes.
Well, riding bike is very healthy, but every minute or so you should stand up. You should release that pressure. Beside the fact that you need to have cushioning, and again, we can have a whole session about how to ride your bike, what kind of pants you should wear, what kind of a seat you have, etc., etc. So just for that. But let's be honest here. Things are not the same as they were when you were 18. When you were 18, the wind gave you a hard on.
This is true.
Right. Right now, you have to have a hurricane to get a hard on. No wind is going to give you a hard on. So it takes much more effort for you to, you used to wake up in the morning with a good morning wood that lasted for a good time. Now, you have morning wood, but it doesn't last for a long time. Is that correct?
That would be true.
You'll say, it's amazing how I know all this stuff about you. And we didn't talk about it, right? No, we never talked about it.
He's reading my mind.
It's amazing. And you used to wake up in the middle of the night several times with, wow, oh my God, that hurts. I mean, you turn around and it was
like a kickstand.
Absolutely. And now it doesn't happen anymore. And things are not as hard as they used to be. The rigidity of your penis is not as it used to be.
Why are you talking just about my penis, Doc? You can talk about everybody's penis.
You're here, but
Kelsey's never gonna date me if she just keeps hearing about my penis.
No, but what the key is, we can fix it. So let's go back to the PRP. So we draw your blood. We're going to put it in a special centrifuge. We're going to spin it very, very fast. At the bottom of the test tube, you're going to have the red blood cells. We're going to get rid of the red blood cells. At the top, you're going to have all the platelets and the plasma and the growth factor and the endothelial growth factors. We are going to use those. We are going to activate them. We're going to inject them back to your penis. There's no pain involved. In your penis.
No!
There will be no pain whatsoever. When I'm done with you, you're going to say, that's it, doctor. Because everybody says that's it. They don't even know that we injected them. The results are remarkable.
And so if I opt in for the P shot, the results are how extreme?
Okay.
Because I'm right now, I would say I'm a good like 7, 8.
Right.
Am I going to be a 10?
So our goal is that you're going to improve.
Not inches. I mean on a scale of 1 to 10. I would say I'm a 7.
So one of the side effects, people ask me, what are the side effects of this procedure? One of the side effects that your girth of your penis is going to increase by about 25%.
Guys, who doesn't want more girth?
So that's one of the side effects of the procedure.
That's a very bad side effect. That's terrible.
So what you expect? You expect your rigidity, how hard your penis is, to improve significantly. You expect the ability to obtain and maintain an erection to improve dramatically. You expect the girth of your penis, not that you need any increase in your girth, but again, we can have a whole session about what's the average guy and what women expect. Women don't expect you to be huge, have a huge penis. They expect you to take care of them, be nice to them, and again, we can talk about what women.
But I
really
do want
want
to know like how big some of them you've seen. I need to know like, have you seen massive ones just in like?
I have seen the whole gamut. I've seen.
Kelsey, do you get to see them too?
Yes.
Oh my God.
So Kelsey had seen more penises than anybody that you can imagine.
Wow.
It's very intimidating for Kelsey, because Kelsey had seen everything.
Yeah, but how many patients do we have? I mean, no one's going to surprise me, shock me, impress me.
That's right.
It is what it is.
It's just natural.
Yeah.
It's like, for me, I listen to a lot of jokes all day, and sometimes I giggle.
Right.
But I hear a lot, so it's not
Sure.
everyone doesn't kill me.
That's right. So again, that's what we expect you to gain from that.
I better do some man grooming before I show
for
up.
sure. So we ask all our patients to. Well, I believe in man grooming completely,
do too.
for several reasons. The number one reason is optics. When you shave your pubic hair, the penis is bigger. I mean
it's a trick. It is a good
absolutely.
trick.
It's an optical trick. It's David Copperfield invented that.
Yes.
It makes sense. So we want to, beside the fact that I will give you also a vacuum device to use at home, because again, inside the penis is a pump. Inside that penis, you have 2 cylinders. Inside those cylinders, there is smooth muscle. Muscle need exercise. If you don't use it, you lose it. You heard that before.
So I saw this thing like, and the girls can do the Kegels, right?
Right.
And the guys, they do the same thing. Like,
so Kegel exercise is really designed for incontinence. Works absolutely. It's an important muscle.
Guys,
for
do
women.
your Kegels.
But for guys, really having sex is the key. That's the only time
Absolutely.
you get oxygen
I
to your
agree.
penis. So having sex, morning wood is important. Why morning wood is important? Because that's the time you get oxygen to the penis. When your penis is flaccid, when the penis is soft, you don't get any oxygenated blood. It's a venous blood. It's not arterial blood.
So we should give a public service announcement to all the male. Tell the ladies they need to have more sex with you.
Absolutely.
And your penis will be very nice.
Doctor's orders.
You heard it straight from Dr.
That's
Dollar.
right. Dr.
Make
Dollar.
you holla. By the way, it's the best name ever, Dr. Dollar. And when I met you, you said like the $100 bill.
That's right.
And I just loved it.
50
I loved
cents.
it. I love it. So keep going.
No, so essentially we want to improve blood flow to that penis. So we want to improve blood flow to the muscle, the smooth muscle inside your penis. So how we are going to do that? We are going to increase oxygen. How we are going to do that? We are going to take some pills. We're going to use vacuum device. We're going to do the P shot. We're going to do whatever it takes, and we're going to exercise. The vacuum device will help you exercise, because after all, Brian, I know you get laid a lot, but you don't get laid,
no, I don't.
not twice a day. You don't get laid twice a day. So we need blood flow to that penis. We need to improve things down there.
Yeah. So just to keep it. So I'm gonna have like a Superman.
you are going to be like a little. We're going to have a little
Tell me,
hero.
so tell me some of the results. You have 55,000 patients in Southwest Florida.
I have 55,000 patients, but
Everybody apparently is horny in Florida. This guy has 55,000 patients.
Yeah, so we have 55,000 patients. We haven't done the procedure on 55,000 patients, of course, but every day we do several of these. I mean, this morning, the first patient for the P-shot came at 6 a.m. We open our office at 5:30 in the morning, which is very convenient for those people that work. And we have a very convenient, we are blessed to have a 7,000 square feet office.
It's unbelievable. It's like a hotel. It's like a resort.
We are state-of-the-art equipment. We are truly, truly blessed to be where we are. It's really the center, it's the only center for both male and female sexual function. And we're talking about, again, feeling sexy. When you leave the office, you're going to feel sexy. You're going to feel great.
Well, I'm nervous. I still am not convinced yet. My problem is it works. What about if you break it?
Let me ask you a question.
How are you going to break it?
I don't know. I never had anyone inject my penis before.
So I will not break your penis, but can you break? That's another topic.
I've been trying to break it for at least 25 years.
So the only time you can break a penis is when your penis is hard. So when your penis is hard, and I had patients that during sexual intercourse they had penile fracture. So you can really break your penis, and it's truly, you have to call me right away, and I have to take you to the emergency room to fix you up. I have to take you to the operating room. So you can break your penis during sex. So when your penis is hard in certain position, if the penis slips out and it hits the bone, you may break it, and you are going to feel that crack, and your penis is going to become flaccid, soft again, very quickly. And you're going to have some bruising. And again, this is something you need to call me. But this is not going to happen to you.
Should I text you right away?
Right away.
Do I have you on your cell?
Call
my Doc,
cell
I broke my penile.
Right away.
I need help.
And we see that in when I was in Boston, we used to see that probably every other week. Here in Southwest Florida, we don't see that often. But probably once a year or twice a year, I see that. I have a patient calling me. But again, that's not from the P-shot. That's from aggressive sex.
So any bad side effects from the P-shot?
Again,
anything?
None whatsoever. I've done several hundreds of these. And we teach other doctors how to do that. No side effect whatsoever. PRP is designed to treat, problems. So it's not designed to cause any problem. It's your own blood. We don't give you anything. This is not a medication.
How many times do you inject the penis, and where does the injections go?
So the injection go right to the shaft of the penis, and we inject it in different places. Again, zero pain whatsoever.
So do you numb it?
I numb it completely. So you have, I give you a strong, very, very powerful numbing cream, and I do also a penile block, so you don't feel anything.
So you do you just go right down like dotted lines, like right down it?
No. This is not one of this stuff. The Kelsey, what's the name of that stuff? Microneedling that you do. No. This is not one of the microneedling. This is really a needle that goes into the penis. But again, you don't even know when the needle goes in.
You scare me when you say it just goes into the penis.
I know.
Is this going to be like a sword going into my penis?
No.
Or is it like a little... Kelsey, don't let him underestimate. Come on, tell me.
I told him I was going to buy him one of those Staples buttons so they can push. That was easy when it's over.
Truly, it's nothing. Again, you are not going to feel anything when we do the procedure whatsoever.
You keep talking about me doing it. I thought we were talking about all the patients that you have in Southwest Florida.
When I shook your hand, I knew you were going to do it. I mean, that was a guaranteed thing that you were going to do.
You thought I was talked in right away.
There is no question about it. I mean,
or he'll just agree because he can come in and I'll be on one side of the table, Mel will be on the other.
That's right.
It's one good way to get Kelsey to look at my penis.
And you get the souvenir, the pump's a souvenir.
We give the pump to every one of our patients. We give them some PDE5 inhibitor. We explain to them. It's really, you feel like in a spa. When you're done, you feel like, you know what?
No, I felt like a spa when I came and got you.
Right.
And the lady at the front desk said, hi, may I help you? And I said, yes, I'm here to see Dr. Dollar. She said, are you a patient? I said, I'm not a patient. I think we're going to lunch.
Yes.
We're going to lunch. And she said, do you have an appointment? I said, I think I have an appointment with him, yes. She was good. She vetted me, very much so.
So you're going to shave your pubic hair. I don't think you have any pubic hair, right?
No,
right, that's right. Let's tell everybody.
Great.
Brian doesn't have any pubic hair. Everybody knows that.
Great.
Nice and clean. And you are going to be well hydrated before the procedure. I really want you to drink plenty of water. And we are going to do one time a podcast about healthy behavior. Water is key for our success for the PRP. We want to be well hydrated. So when I do the procedure,
is there a special spot like that you find, or is it just down?
No, we know exactly. If I teach you everything, you're going to open a place right across the street and be competition.
I'm very competitive,
I'm
Doc.
not going to teach you everything, but we have certain spots.
My people need to know. I mean, they care about it. They want to see the captain's log again. They don't want the captain to go off the, walk the plank here. It's gonna be rough.
So we are going to do a Brian procedure next Tuesday.
No.
And we are going to go live.
He's killing
We're going to do part of the procedure live. So we won't show everything, of course. We are going to show before and after, not the penis itself, but how Brian feels.
Wait,
not during.
This is very important. Kelsey, do you only date guys that have the P-shot penis? Because a regular penis doesn't work? Or what?
Everyone I know, I'm like, you get a P-shot, you get a P-shot.
P-shot for you and for you and for you. It's
She's like Oprah, P-shot for you, P-shot for you. Oh my goodness. So that's, I can see. I mean, that would be enough right there. That would be enough motivation.
Absolutely.
Yeah,
He's like, so you're saying there's a chance. I'm in.
Right.
So listen, the guys have been getting the P-shot for how long?
Meaning how long I've been doing that?
Yeah, how long?
About 2.5 years now.
And now, and when did the women say, I need something?
Very smart.
How long ago did that happen?
Great question. So, in the old days, 20 years ago, we used to treat guys. We used to give them an erection, and then what? What you're going to do with that penis? So women said, hey, we want something for us.
You were making super penises, but the vaginas weren't up to par.
That's correct. The vagina were not ready. And again, most guys think that they can satisfy women with their penis. The clitoris, and again, we can have a whole hours and hours to talk about the clitoris. The clitoris is an amazing organ.
We like those too, yes.
So again, the clitoris is very similar to the penis, and we want to stimulate that. The O shot is, again, and we are going to talk about that O shot because we are going to have a whole session about the O shot, how it works. Same mechanism of action, works amazingly. So women leave our office, they intentionally go over every speed bump because they get the orgasm in the car coming out of the office.
No way.
Yes. Women that never had an orgasm before.
But I mean, in general, the clitoris is much smaller than the man's penis. So do they get, how many shots do they need? So
they also need a couple of shots, and the clitoris is just the tip of the iceberg.
Okay.
The penis itself, the clitoral body itself is inside.
Okay.
The tip of the clitoris is outside. Everything else is inside. So that needs also rejuvenation. And the O shot is, again, amazing. Amazing.
He's learning anatomy today.
I'm learning everything. I'm learning it all, guys. I'm taking this all in right now, and I'm doing this for you. I'm doing this for you.
Of course.
This is some scientific experiments going on in the captain's log right now, and I'm going to report back. We have to have part 2.
We are going to have part 2 next week when you're going to get the P-shot in the office.
So wait, how's it going to start? Explain this to me. All right, maybe I might be interested.
Mm-hmm.
It's Kelsey talked me into it. She talked me into it.
Yes.
That's why I got the job.
That's right.
So explain to me how the day goes, because I'm very nervous.
So you are going to be careful.
I'm driving.
I know. I mean, it's like so. Essentially, you're going to come to the office. You're going to come well hydrated. We are going to put you in our lounge. You saw the lounge, how pretty the lounge
it's
is.
beautiful.
You're going to sit in the lounge. We're going to give you some more water. You're going to drink a little bit more. We're going to take you to our P-shot room. We have a room just designed for the P-shot. We'll give you a beautiful robe.
I need like a couple girls in this, so I look a little, so it looks a little chubbier, like before the start. I want it to look nice.
Right. So we obviously the room temperature has to be just right, not too cold, of course,
right.
Because we believe in shrinkage and we are scared of shrinkage.
Yeah, we don't want that.
So we put the room temperature just perfect, and it smells very good in the room, and we give you a nice robe, and we give you even a flower. And
flower,
yes,
nice.
Absolutely. We give
that's
you a
nice
flower.
touch. You're gonna inject my penis with a needle, but you're gonna give me a flower first.
Whatever it takes.
What a guy!
It's called, we call it foreplay. So we have a little foreplay with Brian. So we give him all this stuff. We put him on the nice bed there. It's beautiful. It smells great. It's, again, bed spa quality. a great pillow and everything else. And I have one of my girls, she gives you the numbing cream, and she puts all the numbing cream, and meanwhile she draws your blood, and we spin your blood, and we do all this stuff.
How long does it take between the time you draw my blood to the time my penis goes on the examining table?
So you are going to be lying down on the examining table while we're drawing your blood. Drawing your blood takes exactly 1.5 minutes.
Okay, and you take like a couple tubes out?
And we take plenty of blood.
Like a lot?
Like good amount.
Okay.
Good amount.
You can't give you all the secrets, guys.
Correct. I can't just teach you everything. You have to take a course by Dr. Charles Ronalds. You know.
Okay. So we take a little blood out.
We take
a good amount. A good amount.
A good amount. Again, enough blood that we need. We are going to put it in a special centrifuge. We are going to spin it very, very rapidly. We are going to get rid of the red blood cells, just extract all the good stuff. We're going to activate that, and we are going to inject it back to your penis.
Okay. And how long does the injections take?
1.5 minutes.
Oh, that's fast.
1.5 minutes. And you and I, we're going to be talking, and you're going to feel nothing. You're not going to know. When I'm done, you're going to say, when are you going to start? That's exactly what you're going to say.
I had a vasectomy, and that was the same scenario. It was very fast.
Yes, this is much faster than a vasectomy.
Really?
Yes, I do a lot of vasectomies, and
you take longer.
I take longer because vasectomy, I have to make it entertaining.
Well, don't go too fast, because if you jab, I'll really get scared. Just
No.
Take your time going in.
We are going to take just the right amount of time.
Okay. So the vasectomy takes longer? Is it more pain?
No. Vasectomy is much more sensitive and more painful than a pea shot.
Really?
Pea shot, there's no pain at all.
I had a rough experience with
vasectomy.
Yeah.
Vasectomy is much more painful overall, even though we use non-scalpel vasectomy. Again, a whole session about vasectomy. I don't want to ruin the pea shot here, but the pea shot has no pain whatsoever.
I have a good story about my vasectomy.
Tell me.
So when you get your vasectomy, they tell you have to have 3 ejaculations in 10 days or something? Is that what it was?
So my rule of thumb is for 3 months you have to have as many ejaculation as you can.
See?
And after 3 months you have to have a semen analysis.
See, this is what I was trying to tell my ex-wife. I told her I have to do it 10 times for 3 days.
But you told her oral sex only. I know you. I know you, Brian.
I told her. I said, this is the doctor's orders. 10 times for 3 straight days. And she believed me.
Yeah.
So I was black and blue from my knees to my waist. I think I overworked it.
No wonder Brian got a divorce. No wonder.
I think I overworked it.
Pump afterwards.
Yeah.
So you'll listen.
Oh my goodness.
We'll give you the pump afterwards. So after the procedure, we'll give you the pump.
Wait, so the pump, these are the things that you see on the internet and stuff, like a penis pump?
Yeah.
And people, they work?
They are going to work for our purposes. Because that pump that I give you has a gauge in it, so I'll tell you exactly to how many bars to pump your penis. We want to bring blood to that area. And again, we can do a whole session about healthy living and how to exercise to improve blood flow to your penis. And I can talk about it for 1.5 hours.
Well, we only have a few more minutes. We're wrapping it up. We're on the captain's log, and I'll tell you, I've learned some amazing stuff. But I'm scared, but I'm going for it. Tuesday, we're gonna do this Tuesday, and we're gonna come back live.
Absolutely.
Are we gonna go live when we're doing it, or how are we gonna do it?
So obviously,
guys, do you want to see this happen? I'm still scared.
It's gonna be from your face. It'll start with the face of fear.
Right. Yeah. We're going to do a little bit live at the beginning, a little bit live at the end, and then we're going to go in the car again. You'll be able to drive, I promise you.
Right away.
Right away. You will be able to do anything.
And then how soon can I test the new
Most of my
products
tested that night.
Really?
So try to hook up already, and you can do before and after. You can have
plan a dinner date for Tuesday.
Absolutely.
Yeah, I have to test it. She's trying to date me already. She knows I'm getting the pea shot on Tuesday. She's already there trying to date. I know how that is, Doc.
Whatever it takes.
I hear you. So Tuesday night, I should run the gamut, or should I wait?
I would not wait for anything. I mean, you never wait for sex.
Nothing?
If you have the opportunity, you have sex. Right. I mean, seriously. I mean, give me a break here.
Oh my God. So should I wait? I think I need to practice on Wednesday and then see what it's like on Thursday. How soon does it take effect?
So
I can't imagine
most of my
it takes
patients-
effect that quick.
Most of my patients feel the effect within 48 hours.
48 hours.
But that effect goes down for the next 2 weeks, and then slowly it gets better and better and better. I have an amazing feeling about you because you are an athlete. You exercise, you eat healthy. We talked about that before, about how important it is that you are going to do amazing. Brian, you are going to be a superstar.
Oh, yes. All right. Well, this is the Captain's Log, and we're coming back at you on Tuesday again with Dr. Dollar. Hold on, I don't hit that car. That wouldn't have been too exciting. But we have an exciting part 2 coming on Tuesday. Dr. Dollar, and tell them about your practice, how they can meet you, and get all the info.
Kelsey, can you tell them a little bit about our practice?
Kelsey, come up here a little closer.
Uh-oh.
Do you have your seatbelt on?
Yes, I have my seatbelt.
By the way, Kelsey is amazing, and she's been back here trying to listen to me, and I've
Nothing
been.
I haven't heard before.
It's really, I mean, she's been a good sport, I'll tell you. Tell us where we can find, get a hold of Dr. Dollar and have super penises from now on.
There's a lot of places you can find us. You can find us on our website. You can look up Gulfstream Urology. We are now on Instagram. What's your Instagram?
Yeah, so
$MD.
$MD at $MD.
Spell dollar because people don't
D
know.
as in David, ALLER. And you can email me. I take emails from everybody. Dollar at teamdollar.com. You can go. I encourage people to go to YouTube.
Yes.
And
he's a big YouTube star, guys.
We love
We're gonna
YouTube.
do more of these. We're gonna start a little podcast and talk about men's health, women's health.
You can find our P-Shot video on YouTube.
Right.
We have another one.
Great. As a matter of fact, Kelsey is the star of that P-Shop.
I saw that. I saw the
We
video.
haven't asked for my autograph yet, but
I figured I would do that on our first date. It's not going to happen right away. I can't just ask for your autograph.
We have about 400,000 people who watch that P-Shot.
Yeah, it's amazing.
And Kelsey thought it was the same guy over and over again. I told her, no, it doesn't work that way. So YouTube, Gulfstream Urology, put Gulfstream Urology. Our phone number is 239-277-5770. We love to hear from you. We love to hear about your experiences, your questions. We are involved. We are on Big Mama 103.9 every Thursday. 7:30 in the morning with the captain here.
The man panel.
The man panel after that at 8 o'clock. We have to invite.
Yeah,
Kelsey.
she can come. She can definitely come. Be part of it.
Absolutely.
Because she's a penis professional.
Absolutely. Kelsey knows dick.
Has she seen more penises than I have?
I hope so.
I have no doubt.
I see mine every day, but she sees 10 a day.
Right.
So that's even more.
I have no doubt that she has seen more penises than a lot of prostitutes. Even.
Oh my God.
She has seen Kelsey.
Don't put my name
her
without
mom.
words
Her
and
mom
stuff.
thinks she works in a bank. But don't say anything.
It's a sperm bank. It's the same kind
That's
of
right.
bank.
That's
It's
right.
the same thing.
That's right.
Well, guys, this is the Captain's Log. We're going to have fun. Next week, I'm going for the P-Shot. It's done. It's happening. You guys are sending too many messages, and I'm taking you up on the challenge. The Captain's Log, Dr. Dollar, Kelsey, thank you so much, guys. I can't wait to see you on Tuesday, and we're signing off. This is it. We're out.